Schizophrenia is a long-term mental disorder that is characterized by a lost connection between emotion, behavior, and thought. The mental fragmentation that takes place in those who suffer from it can lead to devastating effects and withdrawal from reality and relationships into fantasy and delusion. 1 in 100 are diagnosed with schizophrenia, and currently around 1.2 million Americans suffer from this unique disorder, but only 94% of people have heard of it, and of those, only 24% are actually familiar with its causes and effects. So today, we're going to learn about the symptoms, causes, and treatment of schizophrenia. Schizophrenia literally means split mind, and many people take this to define the disorder as multiple personality disorder. However, schizophrenia has very different symptoms, many of which today's patient, Annette, experiences. A lot of Annette's speech comes out as random words with no particular order, and she often travels from one thought to the next with little time put into one topic. Annette goes from one conversation to another and sometimes makes up words as she goes along and spurts out random rhyming associations. What Annette is going through is disorganized thinking, and along with this comes disorganized behavior. This symptom is what worries her family the most, as she seems to have a lack of inhibition and can't really control her impulses. Annette gets fixated on bizarre things, and this has led to a decline in functioning. In addition to disorganized thinking, Annette and many other people with schizophrenia experience delusions and hallucinations. Annette's family has told me that she often tells them that aliens are listening to her and are trying to hurt her family. Delusions like these are unfortunately common among schizophrenia patients. Many believe they are being persecuted, controlled by someone, or other delusions. Annette has also told me that they have been insulting her, calling her mean names, and telling her bad things about her family. These are hallucinations, or sounds and sensations experienced as real, even though they only exist in the person's mind. And hallucinations are very common among those with schizophrenia. They often come in the form of auditory hallucinations. Although Annette does not experience this, many of those suffering from schizophrenia also have a lack of emotion. They lose a sense of enthusiasm and seem distant and withdrawn from the current world. So because of the following symptoms displayed, disorganized thinking, disturbed perceptions and hallucinations, and inappropriate emotions, Annette was diagnosed with schizophrenia. But what caused Annette to have schizophrenia in the first place? Faulty connections between nerve cells during fetal development could trigger schizophrenia. In addition, changes that normally occur during puberty could interact and trigger the symptoms of this disorder. PET scans of those with schizophrenia show us that there is reduced activity in the prefrontal cortex of their brains. There are also abnormally high levels of dopamine in the striatum. This high level of dopamine causes delusions and hallucinations in the psychotic episodes of schizophrenia. In addition to this, there are increased ventricles, or cavities in the brain with cerebrospinal fluid. The frontal eyelids also show rapid rate of tissue loss in those with schizophrenia. Annette's schizophrenia also could have been caused due to environmental reasons. If her mother was exposed to starvation, famine, or even influenza during the second trimester, this could have caused an issue in the development. Environmental stressors like separation from family, death, divorce, etc. in adolescence could trigger the onset of schizophrenia as well. Lastly, any damage to the hippocampus could have also caused the onset of schizophrenia in Annette. 3.2% of Americans suffer from schizophrenia, and despite it not being a fatal illness, suicide causes a premature death of too many. Using the following treatment methods in therapy, medication, and lifestyle, this number can reduce. It is really important to not immediately follow the stigma associated with schizophrenia that it won't get better. Communication and building strong connections can help lower the symptoms of schizophrenia. Going to therapy can also help life skills, managing stress, and improving communication. Group therapy in particular can help those with schizophrenia build connections with others who are suffering from the same disorder. Clozapine, aripiprazole, and Aristata, and more medications can treat delusions, hallucinations, and paranoia of schizophrenia, but it isn't exactly a cure to the actual disorder. These drugs block the dopamine, which decreases the change in perception that those with schizophrenia experience. If you have a loved one like Annette who suffers from schizophrenia, please remember that with proper treatment, people, especially those with acute schizophrenia, can regain normal function using these treatments and many others. Visit an online source or psychologist for help.